Good day to everyone. Today we're going to discuss an adult trained nurse who's having their PIN taken away from them, or otherwise known as being struck off from the NMC register for, or the most serious offence was failing to administer CPR to a patient or a resident at the care home where they worked. So the background information behind this was a referral was made to the NMC by the nurse's employer in relation to concerns with her nursing practice. The allegations relate to two separate incidents which occurred, both in the same year, but with a 6-month gap. The home manager was investigating a safeguarding issue concerning a resident's behaviour towards another resident. After a search of the records were made, it was found that one of the residents at the home was sexually inappropriate towards another. This included touching, but the matter was not raised at the handover or noted down, or there was no safeguarding referral made, which is a duty of all nurses to make those safeguarding referrals when concerns are raised. So for the second event, as to why a referral was made to the NMC, the nurse in question found a resident in bed, cold, pale, experiencing breathing difficulties. When they had seen the patient, they did not call for an ambulance or start CPR. Now, the symptoms described in the document here are not strictly meeting the criteria to start CPR, but would have to assume what they mean by experiencing breathing difficulties is that the breathing the resident was doing was not sufficient to maintain life. The resps would have had to have been less than 8 to begin CPR. And then a doctor arrived to confirm the death, and the nurse gave the incorrect information to the doctor, stating that the patient had a DNAR, which means do not attempt resuscitation notice, when in fact they did not. So that's I would say extremely bad, but clearly there's been a mix-up. I mean, these are extremely important. However, I wouldn't say that this would necessarily make the nurse unfit to practice for the rest of her life. These kinds of things can be forgotten. Is it bad? Yes. Does it make them permanently unfit if they forgot once? Maybe not. But we'll read on. Subsequently raised inquiries as to why the emergency services weren't called and why she'd given the incorrect information. And then she said that she did do CPR. So she's lied. So I think that's going to be the sticking point there. In a lot of these cases, if you put your hands up and say that you've done wrong, it's not a guarantee that you won't be struck off, but it certainly means that you may behave in a way in which this won't happen again. And that may convince the panels that decide what's going to happen to you. They like to hear that you've accepted what went wrong and you're going to learn from it. However, with these two separate instances, I can see why they decided to strike the nurse off. Safeguarding both life and from abuse, both found lacking as pretty extreme. And it's noted here that she was saying maybe it was shock, there was no time to call, referencing an ambulance. Although I think clearly there was time, because if she wasn't doing CPR, what was she doing? In hindsight, I should have asked someone to call 999, but it was a very stressful situation I was trying to deal with. That's in quotation marks. Yeah, it's a shame that someone's had to lose their life and potentially could have been saved. Because as it was noted, experiencing breathing difficulties. So there is every chance that that person could have been saved with CPR. A real shame. Yeah, so she's been struck off with that incident.